My name is Emmanuel Sanwook. I am a Bimoba by tribe. I work in the Upper West region of Ghana, WA, and I work as the regional coordinator for non-communicable diseases for Ghana Health Service. I'm proud I am a Ghanaian, and I'm proud living in Ghana because Ghana is a wonderful country. Ghana is a very peaceful country, and everybody in Ghana is seen as a brother or a sister, so we love each other. It is not by mistake that Ghana is called the Golden Country of Africa. In a typical Ghanaian community, the life of a rural person would involve a lot of physical work. It would involve a lot of eating locally prepared dishes that are very safe and healthy. Currently, over 51% of the total population in Ghana live in urbanized areas. And so everybody is wishing for an urbanized kind of place to live. But now the negative effects are that we are leaving our traditional meals, we are abandoning our old traditional practices that were very good. It is not very easy for people to engage themselves in physical active lives. If you move in town, you see we only have roads for vehicles. They have not been made such that this is a lane for motorbikes, this is a lane for bicycles, and this is a lane for people who want to foot. I developed the passion and chose to go into NCDs because of the neglect. People would actually be surprised knowing that the NCD situation in the developing countries are not much different from the developed countries. If you go out mostly late in the evenings, especially weekends, you find a lot of people drinking and eating a lot of fast food and a lot of fatty food, just like any other city in the world. Facing NCDs in this part of the world is a very huge task. We have diabetes, we have high blood pressures, we have the cardiovascular diseases, and we have some cancers around, especially the cervical cancer. We lose a lot of people to non-communicable diseases. It is becoming a common issue where people get up one day and then they just going about their normal business, and then all of a sudden somebody collapses, and then that is all, the person dies. And so it is actually having an effect on the people economically, socially, and even emotionally, because people lose their dear ones to non-communicable diseases. We now have this double burden of communicable diseases and non-communicable diseases. So the resources are not there, the facilities are not in the perfect shape to comprehensively deal with non-communicable diseases. The only difference for now is that the people who suffer from NCDs in the developed countries, they receive much better care. We need to get everybody understand, let everybody be aware that these are the problems we are facing. Because if the people get to know about non-communicable diseases, they get to know about the risk factors, then they can buy into the education, and then they begin to change their lifestyles, and then we can be making an impact. The Non-Communicable Disease Task Force is a team of health workers who have been put together to screen people in the Upper West region for non-communicable diseases. So we screen them for high blood pressure, we screen them for blood sugar, high blood sugar levels, we check their body mass index to see whether they are overweight, they are normal weight, or they are underweight. Currently we have one diabetic and hypertensive clinic located in the WA municipality. People come from far and wide to access these services. While the services are free, the additional cost of travel and accessories for testing can cost an individual up to like $30 in a week. And $30 is equivalent to a whole household income for a month. So if someone is suffering from non-communicable diseases, he travels very far distances, and they spend almost all the family income taking care of themselves. And so you can imagine the poverty level, you can imagine the stress it brings to the family. Very simple things that can be done to help NCDs prevention and control. We need to build the capacity of health staff. We need to build the capacity of the health systems itself, the facilities to comprehensively screen and manage non-communicable diseases. If we get help in these areas, I can promise you there is going to be a dramatic change and effect. I hope my daughters grow up to live in a country, in a Ghana where the society is free from non-communicable diseases and people live improved lives such that they are able to make healthy choices and they are able to access quality health care. Definitely would become the real shining star of Africa, where almost all African countries want to come and learn from us.
My SM open, me babro chenu na mi so. Nansu krobi ani agenti, manya japa je bia wo fie o. Na menyi ni adu.